7. Miraculous uses of ice in treating health issues in older adults. When we think of ice, most of us immediately picture summertime refreshments or a way to cool down during hot weather. But few people know that behind those small cubes lies a treasure trove of natural healing that has been used in medicine for centuries. Especially for older adults, who often deal with issues like joint pain, poor circulation, muscle soreness after activity, or restless sleep. Ice can serve as a simple, safe, and inexpensive therapeutic tool. In an era where medications come with increasing side effects, and seniors often take an average of 4 to 6 different drugs per day, turning to natural remedies to improve health is becoming a new and growing trend. And ice, perhaps the simplest thing in your home, is now proving its worth in comprehensive healthcare if used correctly. This article will walk you through 7 powerful benefits of using ice to treat and support the health of older adults. Each benefit is explained clearly and in detail, so you can apply it right at home. No need for complicated medical equipment or costly medications. Let's discover how a little cold can bring comfort, recovery, and renewed vitality to aging bodies every day. 1. Ice helps reduce pain and inflammation caused by osteoarthritis. For people aged 60 and above, the signs of joint deterioration become increasingly noticeable. Osteoarthritis, most commonly affecting the knees, hips, wrists, and shoulders, can cause persistent pain and inflammation, significantly impairing mobility and quality of life. Among non-pharmaceutical pain relief methods, cold therapy using ice is considered a simple yet effective solution, widely adopted in the US and many European countries as part of osteoarthritis care. Why is ice effective for relieving joint pain and inflammation? When a joint suffers from osteoarthritis, the cartilage cushioning the bones gradually wears down, leading to direct friction between bones. This triggers inflammatory responses and pain. Ice, with its distinct cold temperature, provides multiple physiological benefits when applied correctly. Vasoconstriction. Applying ice causes the blood vessels under the skin in the inflamed area to constrict, reducing blood flow to the affected site. This helps minimize swelling, one of the key contributors to joint pain. Reduced nerve signal transmission. The cold temperature slightly numbs the skin and tissues surrounding the joint, blocking pain signals from reaching the brain and thereby offering relief. Suppression of localized inflammation. Low temperatures slow down the metabolic activity of inflammatory cells, helping to calm the joint and support tissue recovery. When should ice be applied to osteoarthritic joints? For older adults with osteoarthritis, cold therapy is recommended when the following symptoms occur. Persistent or intense aching in a specific joint, especially after physical activity, signs of inflammation such as swelling, warmth, or redness, indications of acute inflammation. After physical therapy exercises or long walks to help prevent post-activity inflammation. Each cold therapy session should last between 15 to 20 minutes. It can be repeated 2-3 times per day if necessary, but with at least 1 hour between applications. Avoid prolonged exposure to prevent frostbite or joint stiffness. Safe ice therapy practices for older adults. Always wrap the ice in a soft towel or thin cloth. Never apply ice directly to the skin, especially older, more sensitive skin, as it can cause frostbite. Maintain a comfortable position. Seniors should sit or lie in a relaxed posture, using cushions or pillows for support as needed. For example, when icing the knee, the leg can be extended and propped up on a pillow to reduce joint pressure. Do not apply ice to open wounds, scratched skin, or areas affected by skin conditions. Consult a physician if the individual is on blood thinners, has sensory disorders, or suffers from diabetes-related peripheral neuropathy. In developed countries such as the US, Germany, the UK, and France, cold therapy is often integrated into physical therapy routines, paired with proper exercise and nutritional adjustments. Older adults are encouraged to use ice as a supportive therapy, not only to relieve pain quickly, but also to reduce dependence on painkillers, thereby avoiding their harmful side effects on the liver, kidneys, and stomach. 2. Ice supports recovery after falls and minor injuries. Falls are among the most common accidents in older adults. With a skeletal system that has begun to weaken, even a minor trip or missed stair-step can lead to serious consequences, such as bruises, sprains, dislocations, or even fractures. In many cases, hospitalization may not be required, but proper care is still essential to relieve pain and support the healing of soft tissues. One of the most effective and easily applicable home remedies is cold therapy using ice. The biological effects of ice in minor injuries. When an injury occurs, the body immediately responds by dilating blood vessels in the affected area to increase blood flow and initiate healing. However, this response also results in swelling, bruising, and pain. Timely cold therapy with ice can offer several benefits. Vasoconstriction in the injured area. Ice causes blood vessels to constrict, reducing the amount of blood seeping into the tissues and thereby limiting swelling and bruising. Numbing effect on the skin and subcutaneous tissues. Ice helps quickly relieve pain by slowing down the transmission of nerve signals to the brain. Reduction of acute inflammation. Ice slows inflammatory activity, preventing the injury from spreading to surrounding tissues. These mechanisms make ice an effective tool in managing soft tissue injuries after impact, helping to shorten recovery time for older adults. When and how to use ice effectively. Ice should be applied as early as possible, ideally within the first 24 to 48 hours after the injury. This is considered the golden period to control swelling and pain. Each application should last around 15 to 20 minutes and may be repeated every 2 to 3 hours, depending on the severity of the injury and individual tolerance. However, overuse or prolonged cold application can cause excessive vasoconstriction, reducing oxygen supply to the tissue and potentially damaging the skin. Therefore, it's important to follow these safety guidelines. Always wrap ice in a soft towel or clean cloth bag. Never apply directly to the skin. Avoid continuous application. Allow at least 1 hour between sessions. For joints like the wrist, knee, or ankle, secure the ice pack in place using a towel or soft fabric tie. When ice therapy is appropriate, mild bruises after bumping into hard objects or minor falls. Grade 1 sprains, commonly occurring after twisting the ankle or misstepping. Joint or muscle soreness after intense or unusual activities, such as lifting heavy objects. Important notes for older adults. Although ice is a highly effective supportive tool, seniors should keep the following precautions in mind. Do not use on areas with open wounds, abrasions, or bleeding. Avoid cold therapy if the person has peripheral circulatory disorders, e.g., Raynaud's disease, scleroderma. If pain does not improve within 2 to 3 days or is accompanied by concerning symptoms, significant swelling, spreading bruises, loss of sensation, consult a doctor to rule out serious injuries such as fractures or torn ligaments. Ice, with its simple yet scientifically grounded mechanism, is an essential part of a home cold first aid kit that can help older adults recover safely and effectively from everyday minor accidents. When used correctly, cold therapy not only soothes pain but also helps seniors stay active and independent without having to rely too heavily on pain medications. 3. Ice improves peripheral blood circulation in older adults. In older adults, the circulatory system often slows down due to stiffening of blood vessel walls, reduced blood flow, and weakening heart function over time. Common symptoms include cold hands and feet, numbness, tingling sensations, or dull aches in the fingers and toes, especially when sitting for long periods or during the night. Among simple methods to help improve this condition, alternating cold therapy, meaning controlled use of ice, has been shown to be effective in stimulating peripheral circulation. Understanding the constriction-dilation mechanism of ice. When a skin area is exposed to the cold temperature of ice, the small blood vessels under the skin constrict, vasoconstriction. This is the body's natural defense mechanism to limit heat loss. After a short while, when the ice is removed, the blood vessels dilate again, increasing blood flow beyond normal levels to compensate for the earlier reduction. If this process is repeated properly, known as the cold rest cold method, it can enhance local blood circulation, warming up the hands and feet after each session, stimulate natural contraction and relaxation of blood vessels, improving their flexibility and elasticity, improve delivery of oxygen and nutrients to peripheral tissues, relieving numbness, cold sensations, and preventing complications from prolonged poor circulation. Long-term benefits for older adults. For seniors with poor circulation in their extremities, regular use of this therapy may reduce cold sensations in the hands and feet during winter or at night, Accelerate healing of minor wounds on fingers and toes due to better blood supply. Lower the risk of pressure ulcers in people with limited mobility as tissues become better nourished. Additionally, this method can help reduce mild swelling in the ankles or feet caused by blood pooling from prolonged standing or sitting, a common issue among the elderly. How to apply the therapy safely and effectively at home. To perform this method properly, older adults can follow these steps. 1. Prepare a small ice pack wrapped in a soft towel. 2. Apply it to the area needing improved circulation, e.g. feet, ankles, hands, for about 5 minutes. 3. Rest for 2 to 3 minutes to allow blood flow to return. 4. Repeat the cycle 2 to 3 times, not exceeding 20 minutes per session. 5. Practice this 1 to 2 times daily, especially before bedtime or after long periods of sitting. You may combine this with gentle stretching or light massage of fingers and toes in the cold-treated area to further stimulate circulation. Special precautions. Never place ice directly on bare skin. Always use a protective cloth layer. Avoid applying to areas with ulcers, dermatitis, or infections. People with diabetes or sensory disorders should test on a small area first to prevent cold-related tissue damage. Stop immediately if the skin turns pale or numbness persists. Properly applied cold therapy not only relieves pain, but also provides a natural and safe way to improve circulation in older adults. Consistent use of this method can enhance quality of life, reduce dependence on vasodilator medications, and help keep hands and feet healthier and more resilient. 4. Ice helps soothe nerve pain. Nerve pain is a common condition among older adults, often caused by nerve compression, inflammation, or chronic conditions such as herniated discs, diabetes, or spinal degeneration. This type of pain often feels sharp, burning, or tingling, and tends to radiate along the path of the affected nerve. It can be persistent, severely affecting sleep and daily mobility. One of the simplest, most affordable, and effective remedies that many doctors recommend for home use is cold therapy with ice. Understanding nerve pain in older adults. Nerve pain is different from typical muscle or joint pain. It often radiates along a nerve pathway, such as from the lower back to the buttocks and down the leg, sciatic pain, or from the neck to the shoulder and arm, is accompanied by numbness, tingling, or a burning sensation. Worsens with changes in posture or movement. Does not respond well to over-the-counter painkillers. In older individuals, nerve regeneration slows down with age. Pain management requires persistence and often a combination of approaches, among which ice can help alleviate symptoms locally. How ice helps relieve nerve pain. When applied to the painful area, ice relieves nerve pain through the following mechanisms. Local numbing. The cold temperature suppresses small nerve fibers in the skin, slowing down the transmission of pain signals to the brain. Reduces inflammation and swelling around compressed nerves. Ice causes blood vessels to constrict, reducing swelling in soft tissues and thereby relieving pressure on the nerve. Prevents the pain from spreading. Timely cold therapy can stop the pain from progressing into a widespread pain response, chronic pain, helping to protect the central nervous system. Proper ice application for nerve pain relief. The process must be gentle, targeted, and consistent. Here are some guidelines. Locate the main pain point. For example, if pain radiates from the lower back down the leg, apply ice to the lower back or buttocks where the pain feels most intense or tight. Use a soft towel-wrapped ice pack. Never apply ice directly to the skin. Apply for 15 to 20 minutes per session, up to 3 to 4 times a day, depending on the intensity of pain. Lie down and relax during application to reduce muscle tension and improve circulation. Cold therapy can also be combined with gentle stretching or massage after the cold subsides to enhance its effectiveness. When to use this method? Sciatica or lower back pain that radiates to the leg. Neck, shoulder, or upper back pain that radiates to the arm due to cervical spine degeneration. Intercostal neuralgia after a strong cough, cold, or viral infection. Diabetic neuropathy in the feet if approved by a physician. Safety precautions. Do not apply ice to areas with infection, open wounds, or numb skin. People with diabetes, Parkinson's disease, or peripheral nerve disorders should test the cold on a small area first and avoid use if they cannot properly feel temperature. Do not use ice as a full replacement for medications or physical therapy. It is only a temporary symptom relief method. Cold therapy using ice is a simple, drug-free way to bring comfort to older adults suffering from nerve pain. When used properly and combined with a healthy lifestyle and professional guidance, ice can become a gentle companion in managing pain without the side effects of medication. 5. Ice supports safe fever reduction in older adults. Fever is a natural response of the body when fighting infection or inflammation. However, in older adults, fever can be more dangerous due to poor body temperature regulation, weakened immunity, and a higher risk of complications such as dehydration, electrolyte imbalances, and overall fatigue. In many cases, taking fever-reducing medications may cause side effects or may not be recommended if the patient is already on multiple drugs. Therefore, using ice to help reduce fever is an effective and safe supportive measure, especially in the early stages of fever or in cases of mild to moderate fever. Why use ice to help reduce fever? The fever-reducing mechanism of ice is based on physical cooling effects, which help lower body temperature through the skin, allowing for a gradual and safe reduction in overall body heat. Increase heat loss through the skin so the body doesn't have to work as hard to regulate its temperature, making the patient feel more comfortable. Reduce the risk of heat stroke, dehydration, or sudden drops in blood pressure, all of which are common concerns for older adults during prolonged high fevers. This method also helps limit unnecessary use of fever-reducing medications, which can burden the liver, kidneys, or stomach, organs that may already be weakened with age. How to safely use ice for fever reduction. There are several simple ways older adults can apply cold therapy at home during a mild fever. 1. Cold compresses on heat-dissipating areas. Wrap ice in a thin towel and apply to areas with large blood vessels close to the skin, such as the forehead, armpits, groin, and neck, to speed up heat dissipation. Each session should last 5 to 10 minutes and may be repeated several times a day, with 30 to 60 minutes between applications. 2. Cool, not cold baths. For seniors who are mobile, a quick bath with cool but not icy water can help lower body temperature. Avoid bathing if the person is shivering, feeling chilled, or has cardiovascular conditions. 3. Sponging the body with cool water. Use a soft towel soaked in cool water to gently wipe the body from top to bottom, from the center outward. This helps evenly reduce body heat while avoiding cold shock. Situations where ice therapy can be applied. Mild fever caused by a cold, sore throat, or weather-related fatigue. Early-stage fever from uncomplicated respiratory infections. Mild inflammatory reactions, such as after vaccination. When not to use ice for fever reduction, if the person is shivering, has cold hands and feet, or bluish lips, this indicates the body is trying to retain heat and should be warmed instead. If the fever remains high, over 39 degrees Celsius or 102.2 degrees Fahrenheit, with confusion or delirium, seek emergency medical care immediately. Individuals with bleeding disorders, heart disease, or fever from complex medical causes should consult a doctor before using cold therapy. Important precautions. Never apply ice directly to the skin. Always wrap it in a soft towel. Do not let the patient stay in a cold or drafty room while using cold compresses. Encourage small sips of warm water. Provide plenty of rest, and monitor body temperature regularly. When used properly, ice is not only a simple method, but also a safe and cost-effective way to help older adults manage a mild fever without relying on medication. It is an ideal choice for those who prefer a natural, gentle, and effective approach to healthcare. 6. Ice enhances recovery after light physical activity. Maintaining regular physical activity is an essential part of healthcare for older adults. Gentle movements like walking, slow cycling, tai chi, or yoga not only help keep joints flexible, but also improve cardiovascular and respiratory health, as well as mental well-being. However, even these light activities can sometimes leave older adults with mild muscle fatigue, joint stiffness, or minor soreness at the end of the day, especially for those who are just beginning to exercise or haven't been active in a while. This is where ice becomes a valuable, natural, and effective recovery aid. Why do older adults need post-exercise recovery? When the body engages in movement, muscles work harder, burning energy and generating heat. At the same time, microtrauma, tiny tears in muscle fibers, can occur, leading to mild soreness after exercise. In younger people, muscle regeneration happens quickly, so this discomfort is usually minimal. But in older adults, Recovery takes longer. Mild muscle inflammation can persist, causing aching in the evening or the next morning. Without proper recovery, discomfort may discourage continued activity, disrupting long-term fitness plans. The role of ice in post-exercise recovery. Applying ice or cold therapy after exercise helps soothe stressed muscle tissue and reduce microinflammation. Specifically, ice can reduce muscle inflammation. Physical activity increases blood flow to major muscle groups. Ice temporarily constricts blood vessels, helping regulate blood flow and minimize microswelling. Relieve muscle soreness. Post-exercise muscle soreness is often caused by lactic acid buildup and minor muscle damage. The cold effect of ice gently numbs the area, easing pain and promoting relaxation. This technique isn't just for athletes. It's especially beneficial for older adults doing light exercise, allowing them to maintain a consistent workout routine without interruptions from muscle fatigue or soreness. How to use ice effectively for recovery. The best time to apply ice is 15 to 30 minutes after exercising, when muscles are still slightly tight and body temperature remains elevated. Focus on major muscle groups used during the activity, such as calves, thighs, shoulders, arms, and lower back. Use a small ice pack or cold towel and apply to each area for 10 to 15 minutes. Avoid overexposure to prevent deep tissue cooling. Some may also find relief by soaking their feet in cool, not icy water after walking, or using a cool towel to wipe down the body to reduce fatigue and promote overall relaxation. Combine with other recovery techniques. After icing, gentle massage with herbal balm or cream can further stimulate blood flow. Drink warm water or a mild electrolyte solution post-exercise to rehydrate and aid detoxification. Take at least 10 to 15 minutes to rest quietly, optionally with calming music, to help the entire body unwind. Precautions for older adults. Never place ice directly on the skin, especially over areas with thin fat layers like the knees or wrists. Avoid cold therapy on open wounds, inflamed areas, or when feeling chilled. Do not use if the person has impaired temperature sensation, such as in diabetic neuropathy. When used at the right time and in the right way, ice becomes a powerful ally in helping older adults recover quickly after activity, maintain regular exercise habits, and enjoy the refreshing sense of strength and well-being each day. 7. Ice helps relieve headaches and improve sleep in older adults. Older adults often experience persistent issues like dull headaches, tension in the forehead, pain at the back of the neck, or poor sleep quality. These symptoms may stem from poor circulation, blood pressure fluctuations, mild dehydration, nervous tension, or side effects of medications. If left unaddressed, they can lead to daily fatigue, irritability, memory problems, and emotional imbalance. One natural method to soothe the body and improve sleep quality is cold therapy with ice. Why can ice relieve headaches? There are many types of headaches, but the most common among older adults include tension headaches. Typically start from the forehead and spread to the back of the head with a dull, persistent pain. Headaches related to blood pressure changes or weather shifts. Headaches caused by shallow sleep or mild vascular constriction. Ice helps relieve headaches through the following mechanisms. Vasoconstriction in the forehead and neck reduces pressure in overly dilated blood vessels, a common cause of headaches. Soothing nerve receptors under the scalp slows the transmission of pain signals to the brain. Relieving tension in the neck and shoulder muscles. These areas often become tight due to stress or poor posture, which can lead to radiating headaches. Improving sleep through cold-induced relaxation. The gentle cooling sensation of ice can relax the central nervous system, making it easier for older adults to fall asleep. Slightly lower core body temperature, creating ideal conditions for the brain to release melatonin, the hormone responsible for better sleep. Soothe tension in the forehead or neck, where stress often accumulates, resulting in deeper, more stable sleep. How to use ice to relieve headaches and promote better sleep. 1. Cold compress on the forehead or neck, or use a small ice pack or cold towel and gently place it on the forehead, between the eyebrows, or on the back of the neck for 5-10 minutes. Or lie in a comfortable position, breathe slowly and deeply, and consider playing soft music to enhance relaxation. 2. Soaking hands or feet in cool water. Or before bedtime, soak hands or feet in cool, not cold, water for 3 to 5 minutes to regulate peripheral circulation and calm the entire body. 3. Cool towel around the neck. Place a cool towel around the neck for a few minutes before sleep to relax neck muscles and improve blood flow to the brain. Best times to apply cold therapy: about 30 minutes before bedtime, after a long day of activity or walking, or when feeling mentally fatigued or heavy-headed. Precautions for older adults: do not use ice if experiencing chills, fever, or impaired body temperature regulation. Avoid this method if there is a history of vertigo or low nighttime blood pressure. Always wrap ice in a soft cloth. Never place ice directly on the scalp. Stop immediately and consult a doctor if dizziness or prolonged discomfort occurs. A good night's sleep is one of the best natural remedies for older adults. When used properly, ice can help relieve lingering headaches and ease the body into a state of gentle relaxation, improving quality of life while reducing the risks of chronic insomnia or dependence on sleep medications. Old age does not mean surrendering to illness. On the contrary, it is a stage of life where we can take care of ourselves more intelligently and independently than ever before. With just a few ice cubes from the freezer and a soft towel, older adults can relieve pain, recover from minor injuries, relax the mind, and enjoy deeper sleep, all thanks to the thoughtful application of cold therapy. However, the most important factor is not the ice itself, but how we understand and use it, scientifically, at the right time, and in ways that suit our individual needs. Ice is not a replacement for medicine or doctors, but it can be a trustworthy companion on the daily journey toward better health. So don't underestimate the power of the ice sitting in your freezer. Starting today, let it become a part of your own natural first aid kit, so that your later years are not just longer, but healthier, happier, and more fulfilling with each passing day.